This webinar is on perimenopause health and physiology. In this webinar, we're going to be talking about what actually is perimenopause and menopause, the menstrual cycle, 4 stages of perimenopause, hormones, symptoms, and then if you have any questions, you can ask your coach. So what actually is perimenopause? Perimenopause is a transition into menopause, which is defined as a period exactly 12 months after the last menstrual bleed. The journey to menopause can actually begin anytime from mid to late 30s. Usually we start to see changes around the age of 37, and they can be very discreet. This transition through perimenopause or going through perimenopause can last anywhere from 2 to 12 years. It's diagnosed by age and symptoms, so you can't diagnose perimenopause through blood work. And it's a sequence of hormonal events and changes that leads into menopause. Menopause is actually a one-day event, so it's at 12 months. And the day that you haven't had a bleed for 12 months that's when you become menopausal, and then after that, you're post-menopause. Puberty and perimenopause bracket our reproductive years, so is often referred to as a second puberty. So a lot of the symptoms that women go through in puberty are very similar to the symptoms that women experience in perimenopause. So just to have a little bit of a recap of what the menstrual cycle looks like. So as you can see here, there's a nice graph, lots of different colors. Now, when we look at the cycle, and this is a cycle of a woman who is in her prime reproductive years, okay? Now, cycles can range from anywhere from 24 to 35 days, but this one is based off a 28-day cycle. In the follicular phase, this is where we see the most dominant hormone, estrogen, and that's in the blue. And you can see how estrogen spikes and is at that peak around ovulation alongside luteinizing hormone. When a woman ovulates, she releases an egg, and then a gland called the corpus luteum grows, and it then produces our hormone progesterone. So we can't actually produce progesterone without ovulation. When ovulation occurs, we then see this decrease in estrogen, and then we see this rise in the progesterone. You can see the progesterone from that day 16 onwards in the pink. Okay, we still have estrogen present in that luteal phase, so in that last stage of the cycle. However, it's not the dominant hormone. Progesterone is the dominant hormone. We do also see a little bit of a spike of testosterone around ovulation as well. However, testosterone is pretty stable the whole way throughout the cycle. So these are the 4 phases of perimenopause. The first phase is periods are still regular, so there's no change in how regular they are. So if you have a 28-day cycle, or it ranges from 28 to 34, but it's regular, then that is classified as being still regular. However, what we do see in that phase 1 is we do start to see a lowering of progesterone, and this can be due to just shorter luteal phases and we're not making enough progesterone, or it could be due to having anovulatory cycles, which means the female isn't ovulating at all, and so she isn't producing any progesterone. Sometimes in this phase 1, we just see luteal phases get shorter, or we see the menstrual cycle get shorter. This is where making sure that you're tracking your cycle and understanding how long each phase is really, really important. Then we go to phase 2 of perimenopause, and phase 2 is where we start to see more irregular cycles or skipped periods. So now the cycles might draw out to 50 days or 60 days, or you might just not have a period for a couple of months and then it might come back. And usually in this phase, this is where we start to see the onset of some of the symptoms that women complain about a lot in perimenopause. And a lot of these symptoms that occur are due to the decrease in that progesterone, and also this roller coaster of estrogen. And so these highs of lows of estrogen can be the driver of a lot of these symptoms. Now, what I will say is that perimenopause is a natural occurring thing. So what we are going through as a woman in these different phases is totally normal. We can do things, however, to mitigate some of the symptoms. Phase 3 is now seeing lowering of estrogen. So we saw the roller coaster of estrogen. Now we're actually seeing the lowering of estrogen, and progesterone is pretty much non-existent. These cycles get drawn out even more, and again, can be up to 60 days. And this is where women usually start to run into things like insulin resistance. So they may have seen now that they haven't changed their training, they haven't changed their diet. However, they're finding it really hard to shift weight. And this is due to the decline in estrogen. And then phase 4 is called the waiting room. And this is where women have to wait that 12 months without a bleed, or before their final bleed, the 12 months without a bleed to then be classified as menopausal. So they're the 4 different phases. And this is what it looks like on a graph. So in the blue, we have progesterone, and in the red, we have estradiol. And so when we are in those teen years, as you can see, estradiol is the most dominant hormone. And this is where we have this is why it's called that second puberty, because the same again happens in that perimenopause and menopause phase. So estradiol is, the dominant hormone in those teens. It's responsible for breast tissue, pubic hair, becoming a woman. And we can see insulin resistance around this part of a female's life as well. Then progesterone starts to kick in once a woman has had, a good solid year of her cycles. Progesterone is still there. It's just not as abundant, okay? And then when we're in our reproductive years, those prime reproductive years, this is where we start to see progesterone at its peak, and we see estradiol alongside it. Now, as a woman goes into perimenopause, you can see this slow decline, or this, well, it's not really slow, it's actually quite a drastic decline of progesterone. But now you see this roller coaster of estrogen. So see in the red there around perimenopause, you can see how much it is elevated in comparison to progesterone. And this is why women experience a lot of these symptoms. So before we go into the symptoms, I really want to talk about the sex hormones and the role that they play, because you can see how this can influence some women as they go through perimenopause. So estrogen is responsible for the development and maintenance of the female reproductive organs and sex characteristics. It helps regulate the menstrual cycle and prepares the uterus for pregnancy. It really does play a significant role in bone formation, mineralization, and helps maintain bone density. So this is why we tend to see a lot of women who potentially don't do resistance training. They're more susceptible to things like osteoporosis or sarcopenia. So it's really important that we mitigate this loss of estrogen with strength training and adequate amount of protein. Now, estrogen influences sexual desire and arousal in females. It plays a really important role in that cervical mucus production. And so as women go through perimenopause, one of the symptoms can be vaginal dryness. It plays a role in blood sugar regulation by influencing glucose utilization and insulin sensitivity. And this is why when women go through perimenopause, they do become more insulin resistant. It promotes collagen production, skin thickness, and hydration. And again, we can see skin deteriorate or get, not as the elasticity may go, or wrinkles might start to appear. And this is due to the decrease in estrogen. It also influences the distribution of body fat in women, so typically resulting in a higher percentage of body fat in the breasts, hips, and thighs. It influences neurotransmitters activity in the brain, specifically serotonin. And again, this is why women, they'll experience more mood swings, potentially more anxiety or depression, especially when that progesterone is lowering and we're seeing that roller coaster of estrogen. We get this serotonin dump, and that can be a cause of why women feel more emotionally unstable, or they feel they're suffering more from mood swings or anxiety and depression. It has a positive impact on cardiovascular health by promoting healthy blood vessel function. It helps regulate the body temperature, particularly during the menstrual cycle. It affects fluid balance in the body, influencing water retention and electrolytes, and this is why a lot of women will feel puffy in and around potentially ovulation. And they could, if they have kind of estrogen-dominant-like symptoms, they may experience that in the lead up to their bleed, or as they go through perimenopause as well. It also plays a role in cognitive function, including memory and learning, and it also plays a role with alongside testosterone for this as well. And again, one of the symptoms that women will experience going through perimenopause and beyond is potentially that poor cognitive function or that memory loss. I like to call estrogen the yang hormone, so the masculine hormone, the doing hormone. Our next hormone is progesterone, and remembering that progesterone is the first one to decline when it comes to sex hormones in perimenopause. Progesterone helps prepare the uterine lining for possible pregnancy, so it's really important for conceiving. It promotes gestation, preparing the body for conception and pregnancy. It's also a uterine muscle relaxant, so if women have less progesterone or they're not producing adequate amounts of progesterone, they may be more susceptible to painful periods, heavy bleeds, and we see this a lot in perimenopause. We see this as a new onset symptom as well. So they may not have experienced in the past, but they're now experiencing as they go through perimenopause. It influences the cervical mucus, making it thicker and less permeable for sperm. So women become a lot drier in that luteal phase. It also plays a role in metabolism. So progesterone can actually influence metabolism, affecting appetite and energy and expenditure in some. It's also thermogenic. So we are burning more fat at rest in that luteal phase. But when we see a decline in this, it actually impacts the thyroid and our metabolism. And this is why another reason why a lot of women struggle to lose weight when they're going through perimenopause, because it can impact the thyroid. And the thyroid plays a huge role in our metabolism. It can have a calming and mood stabilizing effects. And again, this is another reason why women experience mood swings going through perimenopause, because we see this decline in progesterone. It also plays a role in immune modulation, supporting the body's tolerance of developing the fetus during pregnancy. It also is a temperature regulation. So progesterone it basically increases our basal body temperature. So we'll see a slight increase in basal body temperature after ovulation, and that will stay elevated until our next bleed. And I like to call progesterone the yin hormone, so the feminine hormone. And so when you look at the cycle and you break it into two, we've got the follicular phase where estrogen is more dominant, and then we have the luteal phase where progesterone is more dominant. You have the yang part of the cycle where you're able to do more, and then the yin part of the cycle where you should be more being. It's where you need to fill up your cup more, because women do suffer with more lethargy and fatigue and also mood swings in this part of our cycle. And we can't leave out testosterone. I do feel like testosterone does get neglected a little bit. People resonate with this thinking it is a male hormone only, but women do actually produce testosterone, and it's a really important hormone as well. This, alongside estrogen and progesterone, will decline with age, and it's usually one of the first hormones to decline. It usually peaks around the age of 25. It's relatively stable and doesn't fluctuate like it does in men. There's a slow decline with age, but it's not as affected by menopause. Like I said before, it is one of the first hormones to kind of decline. It's produced in the ovaries and adrenals. It supports ovarian function and is essential for production of estrogen. With estrogen responsible for supporting bone growth and strength, alongside estrogen is testosterone, which plays exactly the same role. It aids in the maintenance of muscle mass and strength, has a neuroprotective effect on cognitive health. So this is where I spoke about before, where it's really important for cognitive function. It can influence energy levels and mood in some women. It contributes to sexual desire. So if you are someone who has low libido, or you have the inability to feel aroused, then it may be worth looking at testosterone levels. It may play a role in clitoral sensitivity and sexual pleasure as well, and it contributes to skin health and collagen production. So as you can see, some of these traits of testosterone cross over with estrogen as well. So now let's look at some of the symptoms when it comes to perimenopause, and these are the most common symptoms. Some will happen in those early years of perimenopause, and some will happen later in those years where you're heading more to that postmenopause stage of your life. So first up, we have the shorter cycles, and that's because we're seeing a decrease in that luteal phase and a decrease in progesterone, and potentially having an ovulatory cycle, so not ovulating at all. You may also experience new onset of longer or heavier bleeding, and this is due to the decrease in progesterone. You may get lumpy or swollen breasts, increased perimenopause mood changes or premenstrual mood changes, increased menstrual cramping, again due to the lack of progesterone. You might also get new onset of waking during the night, and this could be due to that lack of progesterone as well. Could also be due to hot flushes or night sweats. It's very common. And that kind of goes on to the next one, is night sweats, those premenstrual night sweats. You could also experience new or increased migraines, and this is because of the impact that estrogen has on things like mast cell activation and then histamine. So it's very common for women who are going through perimenopause to have a histamine response, and that's due to that fluctuating estrogen and that decrease in progesterone. So it's very, very common. I see this a lot with women, have this increase in migraines and headaches. And then another one is weight gain with no changes to food or exercise, and that's due to that insulin resistance and and that's due to the decrease in estrogen. So going again just into those symptoms a little bit more. So we've got hot flushes, increased PMS, anxiety and depression, sleep disturbance, brain fog, fatigue, histamine intolerance, food sensitivities and eczema, memory loss, vaginal dryness, low libido, insulin resistance, loss of muscle tone, and pelvic floor dysfunction. And these are all because of the decrease in these sex hormones and the way that it can impact so many other functions in the body. It can impact our gut health. It can impact our thyroid health. It's very, very common for women over the age of 40 to be more susceptible to things like Hashimoto's or Graves' disease, which are thyroid disease. The histamine intolerance I've already spoken about before, which can then lead into more food sensitivities, and you might see things like psoriasis or eczema come up with that. So these are very common symptoms as women go through perimenopause. However, you can still do a lot with diet and lifestyle, and taking things out like alcohol and processed sugars, making sure for some people that might be removing gluten from your diet. For others, it might be making sure that you are getting adequate amount of magnesium. And I'll talk about that in the next series of what you can do for your health as you transition through this life stage.